and this is the wave. Okay, so in EEG, as I said, in between the two lines 10 spikes should be present. So here you can see there is a 3-wave pattern. So you can observe the 3-wave. In between you can also observe the spikes. Okay, so this is what we call it as typical absence seizure. So from now onwards, if any patient comes to you with the press his hypogastric region or the abdomen, patient throw into seizures. So this is very important. So in between this, so you can see polyspike and wave appearance. You can see lot of activity here, man. It's a lot of activity. So you can see like at least 3 to 5 polyspikes you can see. So as I mentioned here, you should always act very quick. You should always diagnose very quick, because these 3 diseases which I will tell you, first is stroke, and the second is Guillain-Barré syndrome, and the third is acute bacterial meningitis. I'm not talking about the viral meningitis. It's very specific: acute bacterial meningitis, stroke, and the Guillain-Barré syndrome. These 3 diseases, if you find clinically, you should always question to the patient is that sensory symptoms. What are the sensory symptoms you should remember is that whether patient is having a tingling numbness sensation. Of course, it's basically bilateral symmetrical, so the patient feel on the both side. So patient feel on the both side tingling numbness sensation, especially of the lower limbs. Okay, tingling numbness sensation, especially of the lower limbs, along with the rubbery legs. So of course you ask for the bowel and the bladder movement. So Campylobacter jejuni has some kind of a protein which is similar to that of a myelin protein. Myelin is a neuronal protein which is present in the neuron of the human being, right? AIDP. So the AIDP, most common, around 90% or 90 to 95% of cases are AIDP. What do I mean by AIDP is that acute inflammatory demyelinating polyradicular or neuropathy. Of this session of upper and lower motor neuron. So let me discuss briefly about the one clinical topic, which is pseudobulbar palsy and the left side. Okay, so left side and the right side. Okay, that's why the unilateral involvement of this cranial nerve nuclei, unilateral involvement of the cranial nerve nuclei is symptomless except for the facial nerve nuclei. If you see, for example, the supranuclear is present on the right side of my cerebral cortex, the lesion will be on the left side, which is the contralateral side. So important. For example, any patient of the stroke, or of course stroke comes to you. So if you misdiagnose it as a Bell's palsy, this is, disastrous, man. You need to diagnose as early as possible in these cases. That's why the neuro cases time is very important in acute neuro cases. Okay, so early diagnosis is very important. Early diagnosis and intervention will save the life of the patient. So that's the knees here. So the epileptic aura begins in the knee and ascends to the hypogastrium. This is very important.